Hi, this is a conversation with Dr. Touradj Ameli, and he's a professor of postodontics at the Harvard School of Dental Medicine. Dr. Ameli, what is amazingly new in the area of implantology?
I believe the most amazing era that we are entering is a minimal invasive approach to implantology. Also, the accuracy of how we conduct from the diagnostic stage to planning and execution with extremely precise, a 0.05 millimeter accuracy of how we place our implants based on prosthodontics and restorative phenomena and concept rather than just surgical approach of placing an implant.
Can you share with students a specific example?
Well, the best example is guided surgery. Today we have all the best implant companies, they have advanced the guided procedure, which originally perhaps one of the big company was Nobel Biocare. Today they're all equally very good. We practically take the digital image and we sit behind the computer for hours and we don't even touch the patient. We don't even see the patient. We plan where everything should be and biomechanically correct placement of the implant on our computer screen. And then we send that information to manufacturer. They create a beautiful guide, a surgical guide. It comes into the patient clinic day and we place that implant in just very short time and a patient walks away. And sometimes they have teeth, sometimes just after surgery without any pain, any discomfort, or at least minimal pain or discomfort. That's an advantage of using the 3D softwares and guided surgery.
Do these advances, I guess, apply also to reconstructive surgery?
Yes, I believe it originated from reconstructive surgery, from orthopedic surgery, from trauma cases. And we just applied that to the implant dentistry. But reconstructive surgery, you can create a whole mandible on a 3D and it goes into the manufacturer and the device comes and you can put the patient back together. Practically, very simply.
And of course, this benefits the patient from many perspectives. Can you tell us something about that?
The most important aspect, again, is healing time. We have reduced the healing time. We have reduced the trauma to the tissue. The patients, right after the procedure, they can practically go out and do the back to work and do whatever they choose to do. It doesn't need to go home and rest for days, and I think that's the most advantage of this type of procedure. Some may claim it's a financial aspect of it, but I personally don't think any technology has gave us any freedom of financial. It's becoming more expensive, this type of imaging, but the best thing is the healing and the prognosis. The patient goes out very comfortable without much of discomfort.
And this is now. What's for the future? What's coming? What do you expect?
I think we are still advancing on the regenerative aspect of our implantology and reconstructive dentistry and medicine. We have concentrated for the last 35, 40 years on the surface of the implant, the connecting part of the implants. And today we see a fair amount of literature and research done on how we reconstruct the foundation back to the biological form and shape that it should have been after the destruction. So I think a regenerative procedure will be for the next 5-10 years, will be advancing very rapidly.
Dr. Ameli, what makes you happy? When are you happy after a job of this kind?
I'm never happy. the joy comes when the patient is comfortable. It's all about the patient. It's all about the accuracy of the procedure that we conduct. And every time we complete the procedure, we go back and review, and there's still a little bit more to go. Again, the field of medicine science, it never ends. So the happiness is very short. You finish the project, but you go back and review. You see, we still have to advance science every day. The science never ends. So that goes our happiness.
And if a student approaches you, doctor, and asks, what do you recommend me to begin to get involved in implantology or reconstructive surgery, what would be your advice?
The best advice is I give to my own residents at the school. Whatever topic, implant, reconstructive, minimal invasive procedure, you have to go and look, see who does it. They go one-to-one. Ask the professor at the university, say, can I come and watch what you do and explain to me how you do it? That's the best exposure. Unfortunately, the media take the commercial aspect of it, but the reality, the beauty part of a job is in the clinic with the professors, with the top guys who are actually doing it. That's the best approach.
Thank you very much for sharing these experiences with us.
My pleasure.
And thank you too.